to the ACT throughout October. We do so that we can efficiently deliver our vaccination program. The current advice from the Commonwealth is that we will not see supply of Pfizer to the ACT government program reduced between September and October, as had been indicated in the papers to National Cabinet last Friday. However, we will also not see the increase in supply that had been projected for the ACT between September and October-November. So increased supply of mRNA vaccines to the ACT is now currently all projected to be in primary care. That is Pfizer to GPs and Moderna to pharmacies. Therefore, if you are looking to get an early appointment for your 12 to 15-year-old to get vaccinated, we would strongly encourage you to consider doing that through a GP or a pharmacist. We are in a strong position to provide additional vaccine appointments at the AIS arena if we have more supply, and so we will continue to work with the Commonwealth on this point. We are optimistic that the issue can be positively resolved. During their outbreaks, New South Wales and Victoria both received increased supplies of vaccines. It is our view that the ACT should not be treated any differently. Now, yesterday was another strong day for vaccination across the Territory. Over 3,500 doses were administered in our ACT government mass vaccination clinics. 70% of these were first doses, 30% were second doses. Today we will reach 80% of our population aged 12 and above who have received at least one dose of a vaccine. This number will continue to grow in the days and weeks ahead, but there are around 50,000 people still waiting for a first dose through an ACT government clinic. We are, though, a week closer to having administered first doses to everyone who wants one. And the balance of our vaccination program will soon shift to second doses and significantly pick up pace. 55% of the ACT's population aged 12 and above have now received 2 doses of a COVID vaccine. That's around 200,000 people. And today we've opened bookings at our mass vaccination clinics for 12 to 15-year-olds. But as I say, parents of children in this age group may also find an earlier vaccine appointment is available through a local GP or pharmacist. Now, as outlined in the ACT's Plan Forward released last week, vaccination is the main pathway to move safely beyond our current situation. When the nation moves forward with the national plan at 70%, vaccination rates across the nation, which is anticipated to occur in mid to late October, and 80% by early to mid-November, the ACT's vaccination program will put our city in a very strong position to gradually reopen. But whilst COVID-19 continues to circulate in the community, and whilst we are working to increase our vaccination coverage, restrictions need to remain in place. Our priority over the coming 6 weeks is to look to get as many people safely back to work as soon as we can. We are also aware of the impacts on mental health of ongoing public health restrictions, and we will be supporting a range of mental health initiatives, and we will be prioritising more outdoor activity in the weeks ahead. We will, however, be moving through the phases of the national plan gradually. Decisions will be taken on the best and most up-to-date health advice. So following the updated Doherty Institute advice provided to National Cabinet last Friday, the Burnett Institute advice provided to the Victorian Government and publicly released over the weekend, and New South Wales Health advice to that state government earlier this month, we now have a much clearer picture of the significant risks associated with moving too fast at 70%. The clear advice is that it is prudent to wait until reaching 80% before making major changes. So before making major changes in the ACT, we will of course consider the national and local vaccination rates, the levels of community transmission that we are experiencing at the time, especially the proportion of cases not in quarantine whilst infectious. We'll continue to focus on turning our test rates and turnaround rates in terms of testing results to be as quick as possible. This will assist our ability to quickly test, trace, isolate and quarantine, which will be an ongoing feature of the public health response here in the ACT and around the nation. I think it's important to emphasise here that our obligations to each other don't end when we are fully vaccinated. You can still get the virus and you can still transmit the virus to others when you are fully vaccinated. Other factors that we will be considering as we ease restrictions are how well the community and business are complying with the existing restriction framework. We'll also be looking at the most up-to-date data on the effective reproduction ratio of the virus and the transmission potential within the community. And finally, and very importantly, and we've touched on this a number of times and I want to reiterate it today, we're also very focused on the capacity of our health system, the implications for the cross-border demand on our health system coming from regional New South Wales. And I do note that both the New South Wales Premier and the Victorian Premier have been very clear that they expect the demands on their health systems to be unlike anything Australia has experienced before. Extreme pressure is coming to New South Wales and Victoria's health systems, and it would be naive to think that the ACT system won't also come under pressure. So we plan to ease restrictions as we transition through the vaccination phases in mid to late October and early to mid-November. But this may need to be slowed if we experience significant outbreaks during those times. Like our transition out of lockdown last year, the following types of restrictions will gradually change. Gathering sizes will increase when it's safe to do so. Noting, as we've seen from the Victorian Government's plan, that it is much safer to have events and activities outdoors than indoors. Very large events and gatherings will remain restricted for longer. Density restrictions will apply within businesses, venues and facilities. Again, like last year, businesses will be asked to apply density quotients of 1 per 4 square metres and 1 per 2 square metres as we transition through phases for a period of time, with caps on the number of patrons or clients allowed to enter businesses. The highest risk businesses and venues will remain closed or more tightly restricted for longer. There will be a gradual return to office buildings and workplaces. During the transition phases, we will continue to work from home as much as possible. And as we've discussed, there will be a phased return to face-to-face learning through term 4 when it is safe to do so. Further details of the transition will be advised in advance of each phase through October and November. Right now, we need to give more than 80,000 Canberrans the opportunity to get vaccinated over the next 4 weeks as we continue our efforts to suppress our current outbreak. Now, tomorrow the government will release details of our next mental health support package, and further ACT budget announcements will be made this week with additional funding to support our local COVID-19 response. So for those who've joined late, a quick recap. 7 new cases overnight, all of them linked. Only 2 in quarantine during their entire infectious period, at least 4 infectious in the community. 5 people hospitalised and 2 being looked after by our wonderful extended teams within the intensive care unit, and a particular shout out not only to the staff working in the unit or units, but the support staff who are providing those staff with all that they need to provide the care that these people in intensive care need at this time. And again, we extend our thought and our love to the families of those individuals in intensive care and in hospital. I'll now invite Dr. Coleman to provide an update on the case numbers and epidemiology, and then Chief Police Officer Gagan will provide an update on ACT policing activities and the partnership with the Australian Defence Force. And then we'll all be available for questions together with Minister Stephen Smith. Thank you.
Good morning, everybody, and thank you very much, Chief Minister. So the total cases for this outbreak is now 625, including the 7 new COVID-19 cases we notified since our last update. As always, we do continue to see people recover, and our total number of recovered cases is now just over 400 at 401. We continue to manage 224 active cases across the Territory. And as per the Chief Minister, I can also confirm that all 7 of these 7 new cases are linked to known cases or ongoing clusters, with 6 of them household contacts. 2 of the 7 were in quarantine during their whole infectious period, while 4 did spend some time in the community for at least part of their infectious period, with 1 under early investigation still. As of 8 p.m. last night, there were 5 people in our hospital. Their ages range from 18 years of age up to their 70s. 2 people are in ICU, with 1 requiring ventilation. Of the 5, 4 are unvaccinated and 1 has received 1 dose or is partially vaccinated. We have 800 self-identified close contacts and over 300 active exposure locations still. And just the reminder I give you every day, please keep checking those current exposure locations. And if you have been to one of the identified locations, at the time identified, please follow the advice. As per yesterday, we have no new additional active public sites of transmission, and none of our new cases are actually linked to these current public sites. And so today my shout out actually goes to the team at Libraries ACT. While libraries are actually closed at the moment, this hasn't stopped them from working really hard on developing a range of online content and digital resources to help kids and adults like me get through the lockdown. This does include a range of activities for kids, mums and dads, such as drawing classes, spring gardening advice, and the mystery box delivery service. Please visit library.act.gov.au for more details on these. Also, like other areas of the ACT government, this team are also doing their bit to assist the ACT Health's response for COVID. They've been helping with testing centre check-ins, contact tracing and many other essential parts of the response. So thank you, and I'll now hand over to our Chief Police Officer.
Good afternoon, everyone. Firstly, I'd just like to thank all Canberrans for their efforts, with the vast majority of people continuing to do the right thing. And so I thank you very much for that. We've still got a few weeks to go, obviously, in this particular lockdown, and we must all continue to stay up to date and remain vigilant in relation to the way the health orders are changing. We are seeing a little bit of complacency starting to appear across the Territory, and we really ask people to stay the course and stick to the rules. I just want to remind all Canberrans particularly that all reserves to our west, so Uriata and Cotter particularly, remain closed. Over the weekend we had to turn around about 250 motor vehicles. There was plenty of signage there, but people just ignored that and they were turned around. So please, we ask you not to go to those sort of locations. We are trying to prevent gatherings of large amount of people. This virus doesn't spread by itself. Border compliance activities continued over the weekend, and since Thursday, the 16th of September, we've conducted 7,400 traffic stops. with more than 40 turnarounds. Now, since the commencement of the lockdown, we've actually stopped in excess of 26,000 motor vehicles. And again, vast majority of people continue to do the right thing. This week will be a continued strong enforcement at the border, but we will be assisted by the Australian Defence Force. So this is the first time that ACT Policing have utilised ADF resources on the border. But I will state that we have used them previously in relation to our hotel quarantining. So our relationship with ADF remains strong, and I thank them for their assistance. I just want to clarify very quickly around what role the ADF will be taking in relation to border compliance. They will have three main functions. The first one will be to assist ACT Policing with the marshalling of vehicles. Now, they will not actually stop the cars. That'll be undertaken by an ACT Policing traffic member, but they will assist in marshalling the vehicle to a safe spot so that compliance checks can be undertaken. The second thing they'll assist us with is actually that initial triaging and initial compliance checks. Two primary focuses: one, to see if person has a valid exemption, and secondly, to see whether the person actually resides in one of the 10 postcodes within our region. If it needs follow-up activity, that will also be undertaken by a member of ACT Policing. And the third thing they will do is actually just have general conversations with the public in relation to the health directions and provide assistance in relation to interpretation of those health directions. The next 2 days, we'll be training with ADF and ACT Policing to get our processes right. And Canberrans can expect to see ADF and ACT Policing members deployed on the border from Thursday or Friday of this week. Again, I would like to thank ADF for their continued assistance in relation to this. I'd also like to quickly just remind freight drivers, particularly those coming from Sydney, of the requirement under the National Freight Code to have evidence of a negative COVID test before coming to Canberra. Many of the traffic that we are having to turn around at the border, particularly on the federal highway, is coming from Sydney, where freight drivers do not have that proof of a negative test. So please have that before you attempt to come to the Territory. And finally, before I hand back to the Chief Minister, I'd just like to thank all members of ACT Policing who continue to show significant resilience and commitment in these challenging times. It's unfortunately that police get to see people in the best and the worst, and our members are sometimes having to put up with people that are actually behaving totally inappropriately. And I'd like to thank my members for their continued professionalism during this time. Thank you.
Thank you. Ready for questions?
Chief Minister, you've outlined a general pathway to reducing restrictions, but you haven't done what Victoria has done, which is set out in quite a lot of detail their milestones and specific areas such as business, retail, recreation. Why haven't you done that so far?
Because we're not yet in a position to provide the level of certainty that we would like to in relation to when particular vaccination thresholds will be crossed and the exact nature of the fine detail of those particular settings. Now, I note the caveats on Victoria's roadmap are reasonably clear in that it's indicative only and has estimates around particular dates with caveats around what may or may not happen based on the epidemiology of their outbreak. Victoria's roadmap obviously has differences between metro and regional areas. So I appreciate that there is a desire to have a finer level of detail, and that will certainly be coming. The closer we are to the point at which we ease restrictions, the more definitive we can be. And so it is our intention, as we have foreshadowed checkpoints at the end of this month and then in mid-October, to be able to provide a further level of detail at those points, noting, of course, that the further you are projecting into the future, the more speculative and heavily caveated roadmaps are. Now, I note, for example, that New South Wales has provided no detail beyond a very indicative set of indications for 70%, and broadly have indicated that they think they might reach a particular threshold in the middle of October, and then the Monday after they reach it, they might do a range of things, and have provided nothing beyond that. That reflects the uncertainty that each jurisdiction is experiencing. Victoria's roadmap is, I think, a best guess on where they see their outbreak heading, with appropriate caveats. So I think Canberrans can expect that the next iteration of our restriction easing will contain more specific details, but the details that are most relevant are what is about to happen in the next immediate period. It is very difficult on this day to speculate about what November is going to look like. We just don't know yet. But we will be in a much better position to outline what October will look like in a week or so.
Our vaccination rates are pretty strong, and as you said, there's no real hesitancy in the ACT. By November, the ACT will probably be won't even be more than 80%.
I hope so, yes.
So by then, perhaps because of that, couldn't you provide a little bit more certainty to say business, which obviously needs time to
sure,
get back up to steam?
That's well understood, and I can absolutely give the guarantee that there will be no overnight changes that we would foreshadow in terms of easing of restrictions. If we have an absolute catastrophe, then we may need to change something overnight, but on the basis of an assumption of a gradual easing, we will give considerable notice of change, as has been our practice. So, for example, the changes that came into effect over the weekend were announced last Tuesday, so 5 days notice. In other instances, we've been able to give more than a week's notice of change. So I can give that clear commitment that there'll be no surprises, as in something snap announced, without careful consideration of all of the parameters that I outlined in my opening remarks. So there will be more detail, but what we are very conscious of in striking a balance between people's understandable desire to want every inch of this mapped out for the rest of the year is that I don't want to create a misleading set of guidelines, and we are very conscious that we can deliver more certainty the closer we are to a particular time frame, and so that's going to continue to be our approach. But if you want a high-level steer on things, I think the direction that Victoria has adopted does reflect, as I said in my opening remarks, the latest health advice that 80% is a much safer number at which to make more significant change. That said, even at 80%, it's not without risk. So we are talking about degrees of safety. There's sort of nothing safe at all about COVID. And so I have been very deliberate throughout this process of not wanting to guarantee to people that there will not be more case numbers, more hospitalisations, more people in intensive care and potentially more deaths, even at 80%, because the modelling and the evidence that's been provided to all governments is that that's likely to be the biggest outbreaks we have yet experienced in Australia, will come even at 80%. So that's just a note of caution in all of this, that we must listen to the latest health advice and make the best possible decisions we can with as much certainty as we can provide. And that's the approach we've been taking.
Chief Minister, under Victoria's plan, they're projecting a peak in cases mid-October and then another in mid-December once restrictions ease. What can we expect here, and how does that fit in with what you've been saying about a safer, more free summer holiday period?
I think Dr. Coleman will be best placed to talk about the epidemiology, which she's going to do in some more detail tomorrow. So I think I'll take that part of the question in terms of the outbreak as we're currently experiencing it in the ACT on notice, but we will provide some more detail in relation to that tomorrow. It's fairly clear from the advice from New South Wales and Victoria around when they would be expecting under their proposed roadmaps to reopen, although we don't have the further detail of what New South Wales will do beyond 70%, that there's going to be extreme pressure on the health system in New South Wales, in particular in October, and potentially a further wave if, as the New South Wales Premier has outlined, they expect the highest case numbers they've ever experienced to occur after they open up, which is a logical assumption based on the available data and the fact that there will still be millions of New South Wales residents who have not had any access to vaccination at the time that they make that step. I'm not sure that Australians have quite got their head around what that actually means. I mean, there's been a lot understandable alarm and concern with New South Wales at 1,500 new cases a day. If it rises significantly above that, which is what the Premier is foreshadowing, that's going to put another further wave of pressure on the health system over Christmas. So one of the issues to grapple with here, and I've made this point repeatedly, is that our approach is targeting a safe Christmas and a safer school holiday period. And I think the decisions that are made over the next 4 to 6 weeks will go a long way to determining what summer looks like. And I think it would be really unfortunate if the Christmas gift to the nation is the highest ever level of cases across Australia, the highest ever level of hospitalisation, the highest ever level of people in intensive care, and the highest ever level of deaths in the community. So I think it's really important to be cautious and sensible now in order to provide a better future. And I realise that people want short-term outcomes. We understand that, but we shouldn't sacrifice the medium and long-term for the sake of a short-term sugar hit.
Chief Minister, given Canberrans' strong enthusiasm for getting vaccinated at government-run mass vaccination clinics, has the Commonwealth made the wrong decision in moving vaccines away to the primary care network? And are you frustrated that that's happened at the same time other jurisdictions are offering Pfizer to people aged over 60?
Excellent questions. Well, look, we are able to deliver a very efficient vaccination program through our mass vaccination hubs. It was always envisaged that there would be a role for those sorts of hubs as well as GP and pharmacist delivery, particularly of the mRNA vaccinations. So I don't want it to be perceived that we are unhappy that GPs and pharmacists are going to be asked to do more, but the efficiency of our program is such that we believe we can deliver more vaccines to more people through our mass vaccination clinics. So we stand ready to do more with the capacity to do more quickly, which would help us get to those threshold amounts and get a even greater level of our community vaccinated more quickly. And so I guess I go back to the sort of first principles here that I don't think any other jurisdiction in the midst of an outbreak has had its forward projections reduced. And we will put those jabs in arms if we get them. And so we hope we do.
Hi, Chief Minister. Just on schools, I note that New South Wales and Victorian primary school students will be returning to face-to-face learning before you've projected that ACT students will, despite the fact that the ACT has a lot less COVID, but also has a higher vaccination rate than Victoria. So on what basis do you justify keeping Canberran kids locked down at home for at least 80 days and going back to school later?
Okay, well, I'd firstly draw your attention to the latest Doherty Institute work that came to National Cabinet on Friday that is focusing particularly on immunisation coverage in school settings. It's on the first page of the executive summary of the Doherty Institute update that was provided to National Cabinet, so please go and have a look at that. But it's very clear, and I quote from Doherty, that given the recent shift in the national immunisation strategy regarding this cohort, 12 to 15-year-olds, the next work phase will include attention to immunisation coverage in school settings. Doherty is consulting with Operation COVID Shield, so the National Vaccination Program, to identify vaccine implementation approaches that will influence likely future coverage of schools within their population context. I also note Professor Peter Doherty's views in relation to schooling, that whilst there is not a vaccine available for under 12, so the primary school age kids that you're referring to, that the next best thing that governments can do is vaccinate their parents. So one of the features of our program at the moment is a real priority on getting vaccination rates up amongst the parents of primary school aged students. And so a difference in the ACT as opposed to, for example, New South Wales, because of the additional Pfizer supplies that they were provided earlier, is that our vaccination rates amongst people up to 40 years of age, who would generally be the age of parents with primary school age children, is sitting at, I think at the moment, 35 to 39 is at 36%, 30 to 34 is at 32%, and 25 to 29 is at 28% fully vaccinated. So what we need to focus on, and this goes back to the earlier question and why we are concerned about less Pfizer supply, is that we think it's really important to vaccinate the parents. We've also had the experience in our outbreak already of a number of schools where transmission has occurred, and where what's happened is that kids have got infected from each other and then taken it home to parents. And at one point we had 20,000 people in quarantine. So one of the risks that we're trying to mitigate here is not having tens of thousands of people in quarantine when the inevitable cases emerge in education settings. So we'll take the advice of the Doherty Institute, the advice that's coming forward as part of the National Cabinet working groups on this matter, together with the latest health advice coming out of our own public health area, the input that we will receive from New South Wales. And I note overnight they published a really important study that indicated a hospitalisation rate amongst younger people in New South Wales of around 2%. Now, we've got 80,000 kids in ACT schools. A hospitalisation rate of 2% of those would not only be incredibly distressing for those families, but put enormous pressure on the education and schooling system. So I appreciate that people want kids back at school as soon as it is safe to do so. But our undertaking and commitment to all Canberra parents and to all Canberra school kids is that we will work hard to ensure that you have the safest possible education environment before we begin the gradual return of kids to school. But it is our intent to do that, but we need to do it safely and we need to do it based on the best public health advice, and that's what we'll do. Thank you.
Will there be priority vaccination appointments for Year 11 students before they return to school?
The vaccination team's looking at those options. One of the challenges, obviously, comes back to the supply issue that you identified. We could do a lot more quickly if we got the supply through our mass vaccination clinics. However, of course, Vaccination has been open to 16 plus for a while now. Quickly doing some maths in my head, a lot of Year 11s will have turned 16 by now, and with the 12 to 15-year-old program opening as well, even the younger ones would have opportunity to access vaccines. But I suspect, unless we get the extra supply through our mass vaccination clinics, that the best pathway for Year 11s might actually be through a GP or a pharmacist. So I just encourage people and students of that age to be looking online, both through the My Digital Health Record system for an earlier appointment in one of our clinics, or equally to be looking for an early GP or pharmacist appointment. The supply issues that have been a major constraint to the vaccine program, it's regrettable that they still remain in the middle of September, but we hope over the next 4 weeks in particular that we can get through as many people as want to, and I'd love to be in the position by mid-October that we have put at least a first dose into the arm of everyone who wants one.
Just on vaccination rates, when the ACT does ease restrictions based on those vaccination rates, will we be using the 12-year plus rates when everyone else is using the 16 plus rate? And secondly, will the ACT government be using the March 2021 population estimates or the June 2020 population that everyone else is using?
Excellent questions of detail. So there's not a massive difference between the March 2021 estimated residential population and June 2020 because we don't have an international migration program. There's a small difference, and the 9 months sort of marching of time means that some people move out of one age cohort into the next one. So your 15-year-olds turn 16 and move out of that age group, for example. And then the second issue around 12 plus, the difference in terms of the denominator is 343,000 versus 363,000. In percentage point terms, it means about 2.5% difference. So yes, we are using 12 plus because we are vaccinating 12 plus, but the difference in terms of what that means on the headline figure is a couple of percent, effectively 1 or 2 days of vaccinating. And so we've taken the decision that it is worth 1 or 2 days extra vaccinating to protect particularly our teenagers from becoming infected, noting that younger people experience less severe disease, but still at a 2% hospitalisation rate for those 20,000 kids. That's a lot of preventable hospitalisations and preventable sickness for the sake of a few more days of vaccinating. And I think that's a very, very good decision for those kids and for the community more broadly.
Daniel Andrews has said that he sees pain experienced by the Victorian hospital system as a sort of necessary evil to opening up. What's your attitude about that?
Well, look, there's at any point that you dramatically ease public health restrictions, you must anticipate an increase in case numbers. And we've seen our epidemic so far has seen about a 10% hospitalisation rate. And so in managing this transition, we would want to keep our case numbers as low as possible. The best tool we have against that is the vaccines. So as it has always been, it always comes back to what level of vaccination can you achieve. And let me put it this way, we are more ambitious about our vaccination program than I believe the Commonwealth is. So we think we can go beyond 85%, and I think we should go beyond 85%, and we want to do it as quickly as we possibly can. And the only thing holding us back, as has been the case throughout, is vaccine supply. So we'll come back to that point in discussion. We can vaccinate more people more quickly through our mass vaccination hubs, and I think that's a really important way that we can all move forward, but move forward more safely, noting that nothing is safe when it comes to COVID.
What's the importance of waiting for the national average? Say if the ACT is quite a way ahead on in our vaccination rates.
Sure. Well, look, the national average is driven by the outcomes, particularly in New South Wales and Victoria. New South Wales is arguably ahead of the ACT in its vaccination program based on first doses. The dosing intervals in New South Wales will determine whether they move past the ACT's current rate based on their second dose take-up. Equally, if we are limited in terms of the amount of new vaccines coming into the ACT from delivering it in the most efficient way, that will slow down our projected crossing of vaccination thresholds. So that's a frustrating element of the discussion we're currently having with the Commonwealth, is we think we could get there quicker using our mass vaccination hubs. Victoria is starting to pick up pace because they've finally been given some of the rebalancing of doses that were given to New South Wales early on. Why does it matter for the ACT? Well, everyone is presuming that there will be much more freedom of movement between the ACT, New South Wales and Victoria as we all move towards those thresholds. So it does matter what the vaccination rate is in those other jurisdictions. That was...
It could increase movement within the ACT.
Yes, yes, that's right. But that's the reason that we have the settings that we have at the moment is our local epidemiology as well. So we can't divorce ourselves from that reality. And so one of the reasons we signed up to the national plan was to have a more nationally consistent framework. And one of the key elements of the national plan was the national average and the jurisdictional average. Now, a lot of this debate is coming down to a matter of days difference. So whilst I appreciate there's a massive level of interest in this and an inordinate amount of media attention to these questions, the difference between our point of crossing the national average of 70% and 80%, when New South Wales will reach it, when Victoria will reach it, will be days or a week or so, not months. And it is to clear up another misconception that at least one media outlet were perpetrating last week. The level of vaccination in Western Australia does not have a significant bearing, if any, on the national average or indeed the situation in the ACT. So let me be clear that it doesn't mean every state and territory has to be over 70 or 80%. It's us and it's the nation. And what's particularly important for us clearly is what's happening in regional New South Wales, in Sydney and then Victoria.
So just how significant is this Pfizer hiccup that we're experiencing with the Commonwealth?
Well,
can you quantify a delay?
Well, it could be 30,000 doses, which is more than a week's vaccination, and that's all of the first doses potentially for 12 to 15-year-olds. We've got 20,000 in that group, so you could that 30,000 doses could give them all a first dose, and then half of them a second dose. It's when you've got a population to be vaccinated of about 365,000, 30,000 is over a month is a big number. To put it in a New South Wales context, multiply it by 18, and that will give you a sense, of the sort of number we're talking about there. More than 500,000 doses equivalent, not being provided in a New South Wales context would have a significant impact on how quickly you can vaccinate. And I just repeat the observation that other states in the middle of outbreaks have been supported. I'd like to see the same apply for the ACT. I don't think we've done anything wrong to be treated differently.
Chief Minister, sorry, just on schools again.
Yeah.
So are you committed to students returning face-to-face learning for an extended period in Term 4 when they, if and when they do return?
Yes, absolutely. That's
Okay.
that's the policy objective, but we want to do it safely. It will be graduated in the way that New South Wales and Victoria are proposing. So we could have Year 12s going back at the start of Term 4, Year 11s following a couple of weeks after that, and we'll have more to say on the phasing of the return to school in the coming weeks. But yes, very well aware of it, well aware of your personal interest in the matter, John, and we will continue to work not only internally but also with our state and territory colleagues and the Doherty Institute. But the commitment that I give everyone is we want to do this safely.
The Murdoch's Children's Institute, Dr Nick Coatsworth, have all pointed out there is real damage being done to kids, their education, their socialisation. Have you familiarised yourself with that? Have you spoken to some young children and parents of young children, but kids as well? Because the first-hand experience of parents is it is really having a damaging consequence on young children.
Yes.
And it is real pain out there for them.
Yep, I'm an uncle of 2 primary school age kids. My own team have many primary school age kids. Our cabinet has obviously kids at school. Our public health officials have kids at school. Our education directorate, many of the staff there are also parents, but they are educators, and we need to follow the best public health advice that we can. So yes, we are very conscious of this matter. No decisions here are taken lightly, and as I've expressed on a number of occasions, often our choices are not between good and bad, but between terrible and least worst. So yes, I acknowledge all of those issues, but what we don't want is to put kids and their parents at great risk. We need to do this safely and do it well, and that's what we intend to do.
The pandemic is 18 months old. I note that countries such as Denmark and European nations missed about a month of school in Denmark. They used innovative things like outdoor learning, smaller learning bubbles. We've had a lot of time to prepare for this. It feels like there's now a bit of a late mad scramble to think about how we might prepare. Are we looking at international precedents, and why wasn't a lot of this put in chain? Because our vaccination rates are actually quite high compared to when a lot of other kids around the world went back to school safely.
Sure. Well, I guess in the context of the ACT, we went 450 days without any cases. So
Is that complacency then? Those
no. I would observe that both here and in other jurisdictions that every effort has been made to ensure the safety of students and teachers, and that the research work that was undertaken last year was based on the Alpha variant, not the Delta variant, and that there is ongoing work now, including that was released by the New South Wales Government overnight, the work that Doherty are undertaking that was commissioned a period of time ago by National Cabinet. And there is a desire to learn both from international experience and our own experience, and to put that in place. Throughout all of this, I have taken the view that careful and considered decision-making based on the best advice from multiple inputs is the best way to chart a path forward. So I don't make things up on the run from this podium. I accept and acknowledge lines of questioning. That's perfectly legitimate. But please understand that we take this matter incredibly seriously. We and other jurisdictions are working on it, and our endeavour is to get kids back to school safely, back into face-to-face teaching environments as soon as possible.
Just one more about border compliance. Do you regret not cracking down harder earlier?
No. I mean, the idea that we could have run border operations for 18 continuous months is just not feasible. The measures we had in place worked incredibly well for more than a year. But Delta is clearly a more infectious variant of the virus, and it's proved impossible, even for an island like New Zealand, to keep Delta out once it broke out in New South Wales. If we had sought to have a firm quarantine arrangement, it would have meant no one could have left Canberra without...
I was thinking from the start of this recent outbreak, you've now got ADF personnel assisting. Couldn't we have done that earlier?
We required the cooperation of New South Wales Police and the Commonwealth to be able to move down that path. Now, I raised this at National Cabinet. We got a positive response from the Commonwealth and New South Wales around how we would manage the capital region, and so this is the response and the way that we can do it. At the moment, though, we've got cases emerging right around Canberra that are sometimes in the postcodes that are part of our border bubble arrangements, and sometimes they are just outside, and that is the inevitable result of an outbreak that got out of hand and spread out of Sydney pretty quickly.
Just one for the Health Minister. If that's
Certainly. Thank you, everyone.
Hi, Minister. The Public Service Association in New South Wales is calling for compulsory vaccination of inmates and for certain freedoms to be limited if they don't comply. Is this something the ACT would look at, and are you aware of how the vaccination rates of inmates are tracking?
No, that's not something that we are looking at. I can tell you that the vaccination rates among detainees are as of the 17th of September, which is the most recent data we have, 77% of detainees at the Alexander McConaughey Centre have received a first dose of COVID-19 vaccination, and 63% have received a second dose. Of course, those numbers go up and down every day as detainees are released and new people enter the prison.
Is the high rate part of why you wouldn't consider making it mandatory?
I think there are some significant human rights issues around making vaccination mandatory for detainees. It is a very different proposition than making vaccination mandatory for certain professions where people do have some level of choice about whether they work in a particular profession. People obviously don't choose to go to prison, and it's a bit hard to know what you would do if someone did refuse to be vaccinated. The idea of mandatorily requiring someone to undertake a health treatment or a health procedure like vaccination would require very significant consideration of human rights for detainees, and it's not something that we're giving any consideration to at this point in time.
Just quickly on the Moderna shipment that's coming later this week, how much quicker do you think we'll be able to get jabs in arms when pharmacies are involved in administering that?
Look, I think it's a good thing that Moderna is coming, and I know that pharmacists in the ACT are really enthusiastic about becoming involved in the mRNA vaccine rollout. They've seen really strong take-up of AstraZeneca through pharmacies, including from people under the age of 60. So I'm sure that they will be very pleased about getting involved in that further mRNA vaccination rollout. Beyond that, I'm not really, I think it's just part of the broader vaccine program that we are obviously very enthusiastic about getting as many people vaccinated as we possibly can. And as the Chief Minister has indicated, giving everybody the opportunity to get their first dose of vaccination as quickly as possible. So we have as many people vaccinated as we possibly can coming into the summer. And we know we have very, very low rates of vaccine hesitancy in the ACT, real enthusiasm about getting vaccinated. So the more supply that's available, particularly the more supply of mRNA vaccines, the better.
Do you have any numbers yet on the children aged 12 to 15 booking for a Pfizer vaccine?
No, not for a Pfizer vaccine at this point. Obviously, bookings in relation to the Commonwealth's program, they opened up eligibility at the beginning of last week. We've opened up our bookings today. But as the Chief Minister has indicated, those supply issues mean that probably first dose appointments are not going to be available for some time in our system. As of yesterday, I think the next first dose appointment available at any of our hubs was in around mid-October. Probably those appointments may be gone today. So I think we're looking at, for most people, they would be making appointments through our clinics into November. And so really just encouraging people to have a look at whether they can get an earlier appointment with a GP or a pharmacist. But again, those supplies are not unlimited in those settings either. So 25,000 additional 12 to 15-year-olds on top of the 16 to 29-year-olds and even the 30 to 39-year-olds that we still need to get vaccinated. That's quite a lot of people still to get through.
Has the Commonwealth provided any reason for this particular hiccup with Pfizer?
Sorry, so I think the Commonwealth is in a situation, of course, where they don't necessarily get firm projections from Pfizer either around when specific shipments will arrive, and that does create some challenges for them in providing forward projections beyond 4 weeks to the states and territories. So there is and has been for throughout the vaccination program an ongoing conversation between states and territories and the Commonwealth about what we should be planning for. We are certainly pleased to have received confirmation that our doses for October for ACT government program won't be reduced compared to September, but we had been planning on the basis of an increase in supply through the ACT government program through October and November. So we have the capacity through the AIS mass vaccination clinic to do more, and we'll continue those conversations with the Commonwealth, and we'll very enthusiastically take any additional doses they may be able to send our way.
Right, so it goes back to Pfizer not being able to supply sufficient vaccine to the Commonwealth.
Look, I think it's about uncertainty. So it's not about whether they can or can't. It's about when that supply may be due to arrive in the country. And then it is also about the national planning for how that supply is distributed. Yep.
I had a question about travel between the ACT and New South Wales for either yourself or the Chief Minister. Once the 80% fully vaccinated is reached in New South Wales and also the ACT, will the ACT be allowing fully vaccinated people to travel to and from New South Wales uninhibited? And would that be consistent with the national plan?
So I think those are exactly the kind of considerations that we're in deep conversation with the Chief Health Officer about at the moment, is every single aspect of what our restrictions, including travel restrictions, will look like once we get to those 80% fully vaccinated rates, are the conversations that we're having at the moment. So the Chief Minister, I think, has very clearly outlined the kinds of considerations that we will be making about our own restrictions, but all of those things come into play. And I think the Chief Minister has repeatedly made the point that the national plan, based on the Doherty modelling, does also envisage that there may be local short, sharp responses to particular outbreaks in various regions. So we may be looking at that kind of response if there is a particular outbreak that we're concerned about, responding specifically to that. But that's the exact conversation we're having with the Chief Health Officer.
Thanks, everyone.
Okay, thank you.